ayogera kidda tezimala ezo. Nzaani Mukamange Katikkiro afuna omukisa guno nantalabika ogamba nti mugate engalo nga tuyita Katikkiro wa Buganda okwogerako gye tuli. Ebo sabogereko eri abantu
Mama Joli, Tata Jali, nange jenja kuma takumira mpera chusi jali alunga.
Thank you very much. I am honored to speak at the launch of the Center of Excellency for Non-Communicable Diseases at this historic health facility. I thank Dr. Nsingo for inviting me upon the trigger from Dr. Lumu. And that trigger you mentioned sends you greetings. We've had expert presentations here that highlight the numerous deaths we experience in Uganda from non-communicable diseases. At the same time, we are living in an era of very many advanced technological innovations in the different fields of health and medicine. We understand our bodies better and how the organs function, thanks to research, discoveries, and the attendant applications. And from the statements by the experts this morning, we know what causes most of the NCDs. Despite advances in technological knowledge, we do hear from the same medical experts reports of a rise in what is commonly called lifestyle diseases. Everyone has talked about them. All the professionals here have talked about them. And the irony is, the better our economic situation, the bigger the risk of succumbing to one NCD or another. And like we heard from the experts, those conditions that make us susceptible to getting NCDs are largely avoidable, they are preventable, or their onset can be delayed. In Uganda we say, Asiko bulam tassa mukono. If you are taking care of your life, you do not hold anything back. to implement exercise programs for staff. Intentional leaders should lead by example, encouraging themselves to work out. I urge Dr. Nsingo to work out. It looks like he works out. Look at him. Look at him. Preferably with their staff. Work out with your staff and encourage them to adopt beneficial habits. It's very difficult. In Blanc at 4 p.m., everybody pretends to be very busy. They go behind desks and cupboards and pillars and they hide themselves. They don't want to work out, but you keep urging them. These programs foster unity and teamwork. They demonstrate care and they promote employees' health. These are simple interventions, but they can maintain our health in good stead so that we only visit the hospital for little repairs when we experience the occasional health challenge. I'm very delighted to officiate at the launch of the NCD Center of Excellence of Mengo Hospital. Let us use these facilities for promotion of better health. Let us do routine annual checks. Every May or June, I carry out, a routine body check. I've done this for the last 15 years. I do it. Because many of you doctors don't even do it. Yes, many of you doctors don't do annual routine checkups, but I do it, and I'm not a doctor. When I encourage people to carry out routine checkups, they tell me they cost money. Someone told me they are quite inconvenient. He was over 40 and was going to check for the prostate cancer. And then they tell you to turn over and they insert certain things at the back end of the body and say it is very embarrassing. That's what my friend was telling me. Well, if you succumb to these NCDs, you'll know how costly it can be to treat them. And you can understand how inconvenient they can be. And as we know, late detection of an ailment can lead to death. Checkups facilitate early detection, prompt management, and interventions leading to higher cure rates, or at least management. Every leader everywhere talks about changing lives. We talk about fighting poverty and engendering economic progress. When we work hard, we are likely to lead a dignified life. However, the best aspect of anyone whose life is good health. It is very frustrating to have wealth which cannot be enjoyed because of suffering from NCDs, which, as the experts tell us, can be managed. My sincere gratitude goes to the Board of Governors, to the management and staff of Mengo Hospital for establishing this state-of-the-art facility in commemoration of the World Diabetes Day 2025. The message I have for people living with chronic diseases is for you to utilize this facility fully. Listen to experts. Honor review visits, don't miss them. And take medications as directed by physicians. Please avoid self-diagnosis and self-medication. The internet which many people turn into their general doctors, provides general answers. But hear me out. The internet doesn't look at the condition of your body. The internet doesn't hold any conversation with you. The internet doesn't look you in the eye. When I go to my doctor, he looks at me. We hold a conversation. Even before I explain why I'm before him, he just looks at you. And there is a time I suffered some kind of insomnia. And I went to my doctor. And we sat there. Oh, before he called me into his office, he had told me to wait. And I had fallen asleep. And he saw me sleeping. And then when I went to see him, we started conversing. Then he told him, but I saw you sleeping a few minutes back. Now you are telling me you've got a problem. You don't have any problem. Just take it easy. The internet can't do that. It can't. And I'll tell you this again. The most dangerous medical aspects of the internet are the numerous individuals who claim to be healthcare givers and whose advice in quotes on Facebook, TikTok, and other platforms many people follow. The second most dangerous aspect are the prescriptions which Google provides in a blink of an eye. They are very, very dangerous. Medicine and medical practice are sciences which require technical knowledge from well-trained and approved personnel. That's a profound statement. Promotion and sustenance of good health isn't a game of chances. It's a deliberate and focused effort. We must always be 100% sure that our healthcare givers are trained and licensed to take care of our lives. And you cannot get that assurance from the internet. Whenever I go to a doctor, I ask another doctor whether he knows him. Yes, Dr. Lumu, I ask somebody else whether they know you. Yes. This is not a game of chance. The quacks, you know, all these people in the internet. Actually, China has passed a law. If you talk about medicine, you must be a qualified healthcare giver and a licensed one. If they find you giving statements on the internet about health, when you are not qualified, you go to jail. Government of Uganda needs to think about this. There is something about the internet which I don't understand. I've got a friend of mine, he gets all his prescriptions from the internet. And you tell him, just go to Mengo Hospital, it is nearby. But the internet said you can do this. And then I told him, who is behind the internet? Do you know the doctor? Where did you go to school? I know a few things about medicine, but I'm not a doctor, I'm just a lawyer. I could turn myself into a doctor on the internet. Very dangerous. Very, very dangerous. So I commend Dr. Lumu and his team who are going to run this Center of Excellence. But I also commend the hospital generally for preserving these old structures. The history of Mengo Hospital is very important to the provision of health care to Ugandans. Ebiseera bye tulimu bya teknologiya na buvumbuzi obwa waggulu. Era kaakati tumanyi ebivaako endwadde zino ezitatulira. Okutulira kwe kusiiga, naye olwo Oluganda abawana Mengo mu ddwaliro baba lumanyi. Ekivaako endwadde ezitatulira ezitasiigibwa nga sukaali, ng'entunnunsi, ng'ensigo, okulwala ensigo, okulwala omutima, ebintu bwe bityo. Naye wadde tekinologiya agenze waggulu, tufunye endwadde ez'obugayaavu. Endwadde ez'obugayaavu zeezo ezireetebwa engeri gye tweyisaamu. Mwe abali wano abalina ku ssente mulya emmere nnyingi nnyo, mulya ebisiike, mwagala nnyo ebiwoomerera, muli banafu, temwagala kukuluusana. Mulya mmere nnyingi nnyo, mulya ebisiike, mwagala nnyo ebiwoomerera, muli banafu, temwagala kukuluusana.
Nati Hands-On School of Skills ekuletedde ofa omwaka guno naddala gwe eyamala sini ey'omukaaga n'eyokuna weewandiise mu bwangu ofune amagezi ag'okukola omulimu gw'omutwe n'emikono. Ku Nati Hands-On School of Skills tusomesa amasomo mangi ag'ebyobulamu obwa bulijjo mu diploma wamu ne certificate. Kati gwayanguwa mu bwangu ne weewandiisa ku Nati Hands-On ojja kusalibwako ku bisale ebya bulijjo mu courses zonna z'oyagala. Weewandiise kati ku Nati Hands-On School of Skills okozesa omukisa guno aba Liberation Community Finance gwe bataddewo okuyambako omuzadde omufunira ssente okuweerera omwana mu Nati Hands-On gw'omuzadde n'ozizaayo mpolampola okukugulira ebikozesebwa ng'ogenda okwetandikirawo omulimu naddala ng'omaze okusoma ku Nati Hands-On. Jangu oyiga amasomo gano wammanga: hair styling, braiding and weaving, pedicure ne manicure, business management, catering ne hotel management, body massage, makeup, okusiba dreadlocks, okuvuga emmotoka n'okukuyambako okufunira driving permit, okuyiga computer, okukola wig, okusala enviiri n'ebirala ntoko. Tulina n'ebisulo eri abo abava ewala. Okwewandiisa tukubasa kugenda mu maaso ku ofiisi zaffe ku luguudo oluva mu Lubigi okudda e Nabweru oba kuba essimu ku noti 755 852 365. Nati Hands-on School of Skills tufaayo okubangula omwana wa leero okwetandikirawo omulimu.
Babakebere bababuulire ebibaluma. I think that's enough message at the launch of the Center of Excellence for NCDs here at Mengo Hospital. And with those few remarks, I think there are many remarks, I declare this NCD Center at Mengo Hospital open. Sabasajja Kabaka Wangare, Ganenkumbi Kubega.
Tweyanzayo Mukama wange Katikkiro mu kiseera kino. Mukama wange mu bitugamba nti bajjajja bagamba nti engalo ensa. Salongo omukulu w'eddwaliro alina byagenda okukwasa ku lwaffe Philip. Bansabye nti Philip ne Waswa ate ne Miss Wellness basembere ng'omukulu w'eddwaliro akwasa Katikkiro. Kyanatunulangako n'agamba nti ku lunaku luno natongoza NCD Center. Kamange Katikkiro okkirize abakulu abali emabegawo bakweyungekaawo tufune ekifaananyi eky'ekijjukizo. Dr. Net. Ekifaananyi ekyo eky'ekijjukizo. Directors. Director Joel Pamela. Directors ffe batukiikiridde ffe abakozi abalala mu kifaananyi ekyo eky'ekijjukizo. Ekitiibwa kya Buganda ekitundu ekyokutaano nga tuwonga Ssaabasajja Kabaka maaso ga Basebo ne banyabo Katikkiro ng'agenze tugenda kugenda mu maaso n'olusiisira lw'ebyobulamu. Batutegeezezza nti tuli Buganda era olugendo enjala teruggwa. Emabega awo waliwo ebibala bye tugenda okulya. So eyamaze okukeberebwa ng'ofuna ekibala omusumba yasabye naye tukyaliwo nga omusumba abalala tukyaliwo nolwekyo tetufunye essaala eggalawo kuba abalala tukyaliwo naye omukulu ng'agenze tugenda kufuna ekyokulya ate abagenda okukeberebwa bagende mu maaso. n'abaddayo ku mirimu tuddeyo ku mirimu. Twagala okwebaza Katonda olw'ekiseera ekyo kyatuyisizaamu. Tubajjukiza basebo ne bannyabo nti mu nsonda eri omukono gwange gye gutunudde we wali olusiisira lw'ebyobulamu tukeberebwa obuzito bwaffe, pressure awamu ne sukaali. Abaami bakebeera prostate gland oba katungulu, ate era abalina sukaali ne pressure bakeberebwa ebigere. Waliwo okebera akawuka akaleeta mukenenya, ate era waliwo n'okufuna eddagala ng'abasawo bwe bana babagambye. Ku mukono guno ogw'ekyemmanga basebo ne bannyabo waliwo bannamikago baffe, ba exhibitors, ba service providers baffe. Mubakyalire abasawo, abantu baffe, abantu abo mulabe ebitabo bye balina nabutugasa, oba oliawo tuwe n'abakulu amagezi okusobola okutugula era n'oluvannyuma tufune ekyokulya nga bwe tulungamizibwa.